Everyone, I'm Dr. Hasna, brought to you by UK Pass Academy, and today I'm teaching you the examination of a shoulder joint. I have a very nice student here with me, and he is going to be our patient today. Let's call him John, all right? And let's begin with the shoulder examination. The first thing that I've always taught you, everyone, never forget, doctors, to do the E square, C square, P square. Before you take a brief history, obviously, you will take a brief history before that, and then you'll proceed to the procedure or the examination itself, and that begins with the E square, C square, P square, which involves the explanation, it involves the exposure, it involves the chaperone, it involves the consent taking, it involves the P for privacy, and finally, position. In a shoulder joint examination, you're mostly going to have one complaint, which will be pain, either with stiffness. All right, so we need to get to the bottom of what's going on, and there are only mostly two conditions that are going to be going on, which we'll talk about shortly. All right, so this is John. Let's tell John, obviously, assuming I've built my rapport, I've told him who I am, we've had the whole confirming his name and age, then I'll proceed. All right, John, so you're telling me you're having a little bit of shoulder pain.
Yeah.
So I am going to do your shoulder joint examination, okay? It will involve me just having a look and a feel of your shoulder joint and some special tests. I will be as gentle as possible. If you want me to stop, you can ask me, okay? And if you're okay with it, can I proceed?
Yeah.
Okay. So I want you to know your privacy will be maintained. There'll be a chaperone with me, all right? And I just want you, if you could take off your shirt and stand for me, and I'll be ready to perform the examination. So once you've briefed that to him, you've covered your E square, C square, P square. So what was going on in my mind while I was talking to him? In my mind, it was like, have I ticked this? Have I ticked this? Have I ticked this? Have I ticked this? So make sure that's what's happening in your mind. Okay, now let's move on to the actual examination. What you do is the IPS. Because it's a PLAB 2 exam, everywhere there's IPS. Whatever exam you're giving, interpersonal skills are important, right? So all the examination begin with an inspection, palpation, and special tests, and that's exactly what we're going to be doing. So let's assume that John has given us adequate exposure. All right, we can see John has taken off shirt. You are looking at the shoulder. All right, John, could you just stand here for me? First thing is inspecting the shoulders. How do you inspect the shoulder? First thing, you need to look from the front. Okay, you're looking at the symmetry, the contour of his shoulders, any scarring, bruising, or any other kind of positive finding you can see. You go on the side, you observe. And finally, you go to the back and you observe. What do you observe in the back? You're looking at the scapula, and the most important pathology of scapula is the winging of scapula. You're observing for all of these things while you're looking at him, and you're just having a look silently. All right? Once you've done having a look, now what you're going to do is you are going to move to the palpation. So all palpations begin with taking the temperature. So we're going to take temperature of his shoulder joint. At the back of my fingers, I will compare his temperature with his arm. We're going to do the same on the other side. Could you come in the center? We're going to repeat the same on the other side. What's important here is that you're doing everything on the other side. This is something that usually doctors might forget. So I'm reminding you over and over again. All right. So we're done with the temperature. Next thing is to check for the tenderness. How do you check the tenderness? You're going to go in order. Let me show you what a shoulder joint looks like. There is a sternum. The sternum is bound to the clavicle bone. A little bit anatomy. This is the sternoclavicular joint. Then you have the shoulder joint, which is on the lateral side. This is, you're going to have your head of humerus. Inside the glenoid cavity of scapula, you have the acromion process, and then you have the coracoid process. All of these are just involved in forming the shoulder joint. So your strategy to palpate the patient is going to be checking the tenderness on the sternoclavicular joint, any clavicle tenderness, then any shoulder joint tenderness, head of humerus tenderness, coracoid tenderness. You're just going to be touching these areas. And then you go back and you palpate. First, I'm going to palpate his, locate his sternoclavicular. Is there any pain?
No.
Okay, John. If there's any pain, you can ask me to stop. So keep doing that for good interpersonal skills. And then you keep going. Then you get to the shoulder joint. Then you palpate the head of the humerus. Okay. This is this entire area you're just palpating. Then you quickly palpate the deltoid tuberosity. Now, you could turn your back towards your back. And now you just quickly palpate the scapula as well. Is there any pain here, John?
No.
Medial border of the scapula. Good. Okay, so this was the tenderness check. Make sure to ask the patient where exactly is his pain so that you are more gentle on those areas. We're done with the tenderness. Okay, temperature, good, and tenderness checked. Now the next most important part of examinations of joint is examining the movements of the joint, obviously. Okay, so what are the movements of the shoulder joint? The first movement is flexion. So you ask John, all right, John, what I want you to do is repeat the actions that I'm doing with my arms, and you're going to do the same. All right, so first thing is the flexion. He's going to mimic me. He's doing it fine. All right, then you're going to do extension. Okay, John, could you do this for me? Yes. All right, and now can you bring them back as much as you can? This is the abduction and adduction. And finally, you're going to do the internal and external rotation. John, I want you to put your arm at 90 degrees with your elbow. Very good. Now you do inside. Now you go outside. All right. Could you repeat the same with the other shoulder? So these are active movements. Okay. So special test, first thing is active movements. He is going to do them himself. We're going to see where the pain is. All right. Next, we're going to do the passive movements. All right, John. Sorry, this comes under special test, obviously. What are the passive movements? For instance, John said, there's pain when I do this. Then you will have to passively move it. John, is there pain when you do this? Yeah. Okay. So I'm just going to do it. Tell me when the pain goes. Now, okay, stop. Be gentle. Okay, be nice. Patient comes first before your examination, of course. Next is active movement done, passive movement done, and now the actual special test. These are the empty can test and painful arc test. These two are, you're going to perform these two. Okay, first thing is empty can test. Okay, John, what I want you to do is take your arm like that. You're just going to ask him to mimic. Okay, what you're going to do is you're not going to be in complete abduction, nor are you going to be complete flexion. It's going to be an angle midway this way. That's how you're going to want him to come. Okay, now what you're going to do is you're going to ask him to downward rotate. Yes, exactly. Downward rotate his thumb. Basically, it's a rotation of the humerus or the shoulder joint. Once he's done that, John, is there any pain? All right, you ask. Now what you're going to do is you're going to take it down. And when you do this, he's going to feel pain. Okay, this is when you're going to say ouch.
Yeah, ouch.
Ouch. Well done. Okay, so this is empty can test, positive, most common in shoulder impingement. We're going to talk about it in a while. The second test is you're going to repeat the same on the other side. Don't forget, doctors. And the second test is okay, John, what I want you to do is take your arm and take it all the way up. Now, so what's going to happen? What is a positive test when it's the painful arc test? A positive test is that John will be okay in the first few degrees of the motion, but in the center, when he's going from 30 degree to 60 degree angle, he's going to have severe pain. And after that, there's no pain. Okay, so this is also a sign of shoulder impingement. So once you're done, you're going to ask, okay, John, you can now dress up. I'm done with my shoulder examination. Thank you so much. So don't ever forget covering the patient or maintaining the dignity. If it was some examination which had a cover on it, make sure you recover. If John has removed his shirt, ask him, he can wear his shirt again. Say thank you. All right. Now let's talk about two main conditions when it comes to pain. It can be either frozen shoulder, and we're going to talk about the positive findings in both of them. Main conditions of the shoulder pain are either frozen shoulder and shoulder impingement syndrome. These are two things you're going to be wanting to differentiate in the exam. Okay, what are the positive findings in a frozen shoulder? Active movements will be restricted all around. Active movements, all. It affects all movement. This mostly it's the movement when he's trying to go above. All the upward movements will be restricted. So it's more restricted towards or limited towards the upward movement of the. So in a frozen shoulder, when you're going to be asking him to do the movement, every time he goes up, it's going to hurt. Every time he goes up, it's going to hurt. Every time he goes up, it hurts. With the impingement, it's usually, impingement is, with the frozen shoulder, it hurts, it hurts, it hurts, it's going to be restriction of all the movements. But in shoulder impingement, it's mostly going to be, I'm fine, it hurts when it goes up. It's fine, it hurts when it goes up. All right, so that's one difference. The other difference of the two is that in frozen shoulder, you won't have the empty can and painful arc positive, whereas over here, both tests will be positive. All right, So these are the most important differentiating features between the two. Their treatment is the same. You give analgesia, physiotherapy, and refer to the orthopedic for steroid injections. All right, so that's all for the shoulder examination. I really hope I made sense to you. Thank you so much for watching.